Susan Taylor with Scripps Health in San Diego, California. You've got a sore throat, maybe ear pain, a cough that won't go away, or you're chopping up vegetables for dinner and you cut your finger and it's bleeding really badly, or your baby spikes a high fever on the weekend. Let's say you fell off your bike riding home at sunset and you really twisted your ankle, or you're at home and just before bed, all of a sudden you get severe pain in your tummy, or maybe you are short of breath. You're feeling dizzy, weak, numb, slurred speech. What should you do? Where should you go? Urgent care, the emergency room, perhaps a walk-in clinic, or should you be calling 911? Knowing the difference between these places to seek medical attention could actually save your life in a medical emergency. Here to talk about this is Dr. Sean Evans, who is an emergency medicine doctor at Scripps Memorial Hospital in La Jolla, California, and Dr. Sue Ming Giri, who is an internal medicine specialist and vice president of primary care for the Scripps Clinic Medical Group in San Diego. Thanks so much for joining us.
Thank you.
Let's talk about these different places to get care. Let's start with urgent care. What is the definition of urgent care?
Something where you have a disease or an illness where you're not going to have life or limb-threatening problems within a week. So somebody who may have matured an illness or has an exacerbation of an illness that they have, that might be after hours, for example, or anything where someone doesn't feel imperiled, where they know they're going to live more than 24 hours.
So, and the difference between urgent care and the emergency room?
Emergency department is traditionally reserved for people who feel they won't have 24 hours to live, or they have a limb-threatening event. So somebody who has had a sudden accident, a sudden severe headache perhaps, they can't see, ultimately fever and neck stiffness, or they're unable to swallow, chest pain, pain radiating to their back, sudden abdominal pain, vaginal bleeding, for example, with abdominal pain in pregnancy, all represent emergencies, as there can be life or limb-threatening injury or illness within 24 hours.
And let's talk about these walk-in clinics. What kind of symptoms would propel you to go to these Scripps HealthExpress? So these are walk-in clinics that are now open 7 days a week across San Diego County.
So unlike urgent care and emergency rooms, our walk-in clinics are really for low acuity problems, things that you do want to be seen the same day for. You don't want to wait, for example, cough, strep throat, urinary tract infections. You can have abdominal pain, rash, minor sprains, minor trauma, things that are not serious enough to warrant a trip to the urgent care or the emergency room, but your doctor may not have an appointment for you that day. That's exactly what I would use the walk-in clinics for.
And when do you call 911?
I think what 911 should be reserved for people who typically can't mobilize themselves, they can't get up and walk on their own, someone who's dizzy, has chest pain, someone whose blood pressure may be disturbed, somebody who, for example, has been injured and can't get up. That's when traditionally 911 is reserved. Automobiles, they shouldn't drive themselves, but if they have somebody, a neighbor or a family member who can get them to the hospital within 10 to 15 minutes, typically they're going to do fine.
I would also add that 911 is for when there are conditions that should not wait to be treated. So we think of heart attacks, we think of strokes, we think of severe rapid bleeding. In those cases, time really is critical. And if you call 911, the ambulance can take you to the emergency room that much more quickly. You don't have to deal with traffic. You have to reserve it also for those conditions.
We'll come back and talk about this in a couple of minutes, but you just made me think of something. Why are people reluctant to call 911? Because you hear all these crazy stories about people driving themselves to the ER when they're having chest pains or they're dizzy. Why they are reluctant to call 911 and drive themselves. We'll come back to that in just a couple of minutes. Let's kind of go through let's like laundry list the symptoms, and then you tell me where you should go. Whether you should go to a walk-in clinic, Scripps HealthExpress, for example, or urgent care, or ER, or call 911. So let's go through them. Slurred speech.
That's emergency department.
Emergency room. Okay. Serious burns.
The
Emergency room.
Chest pain.
Emergency
That sounds like a
room.
heart attack, right? What about a concussion, broken bones, a head or eye injury?
Yeah, that's the
Emergency
department.
room.
That is.
Yeah, and the nice part for any of these, Susan, is that if somebody goes to the urgent care, the physicians there are going to treat them perfectly appropriately and get them to the emergency department as soon as possible if they need to.
But let's say you've fallen off your bike and you're bleeding and you think you might have broken something, you've really twisted your ankle really badly. Should you go to the ER or should you go to urgent care for that?
I think either would be suitable. Yeah.
And what about a head or an eye injury?
Well, when it comes to the eye, I'd have to say that's pretty important. When you've hit the head, the issue is does the urgent care, and all of the urgent cares within Scripps can do CAT scanning. Outside of that, many urgent cares cannot. They don't have advanced radiologic equipment. If you're going to an urgent care, you may want to make sure that they have the ability to actually take care of that particular illness.
What is a CAT scan?
A CAT scan is an imaging test that can be done where we can look at the brain and determine whether there's swelling or bleeding after an injury.
Okay. And then Scripps ERs are located where?
The emergency departments are in Encinitas, La Jolla, Midtown at Hillcrest, and Chula Vista.
Okay. And then let's go through urgent care. So urgent care is non-emergency care, right? But it's really something that can't wait till tomorrow, would you say?
Things that can't wait are things that probably shouldn't wait. I think, Susan, the important thing to remember is our emergency rooms are typically attached to hospitals. So people who need surgery or rapid access to specialists, trauma surgeons, etc., an emergency room would have those. Urgent cares can be freestanding, so they may have a lot of the amenities you need to treat broken bones and to diagnose fractures, for example. They can give IV medications, but they are not attached to hospitals, so they're kind of an in-between. An important thing to remember about our urgent cares, and similar to emergency rooms, is that if you're not extremely sick, you may have to wait because other patients who come in who have more serious conditions, serious problems, will be seen before you.
So if somebody's coming in with symptoms of a heart attack, they get treated right away. Correct. So for urgent care, let's do fever without a rash,
Correct.
dehydration.
Perfect.
Let's say you sprain your ankle.
Yep.
Okay.
Well, I would say if you can actually walk, you could probably go to a HealthExpress clinic. Because for minor sprains, you can actually go to a walk-in clinic. It may not need an x-ray, but if it's a serious injury that involves high impact, you fall from a heavy height, you actually are in a moving vehicle and you get injured, I would recommend an urgent care or an ER for that setting.
I would agree, and I'd say that if there's significant swelling or bone deformity, that's probably time not just for an urgent care, but to be considering an emergency department.
What about wheezing or shortness of breath?
Most wheezing, it would be dependent on the individual. Healthy person wheezing in urgent care would be perfectly fine. Somebody who's had chronic disease or pulmonary problems who's wheezing probably should come to the emergency department. There's a higher likelihood of that person requiring hospitalization.
Okay. What about dehydration, throwing up a lot, or diarrhea?
I would say urgent care for the vast majority of people. However, if they have illnesses that take away their immune system, if they're on chemotherapy, if they're in an advanced age, or if they've suffered from other illnesses and have some complex medical background, the emergency department is probably the destination of choice given the likelihood of them needing hospitalization.
Okay, so the urgent care is located where across the Scripps system?
Torrey Pines, Vista, and Rancho Bernardo, and all have advanced imaging.
And then the walk-in clinic. What would you go to a walk-in clinic for?
Our Scripps HealthExpress clinics are ideal for low acuity problems such as eye pain, eye redness, allergies, ear pain, ear infections, strep throat, bladder infections, skin rashes. In fact, we even do sports physicals.
So talk a little bit more about the Scripps HealthExpress because let's talk about where they are first of all.
So we have 12 locations throughout San Diego County. There's Rancho Bernardo, Mission Valley, Carmel Valley, Rancho San Diego. There is Solana Beach, Vista, Hillcrest. I mentioned Encinitas, thank you.
East Lake.
Yes, there's also
Okay,
East Lake.
there you go. I think you got them. That's good. There's a lot of them. The bottom line is that there's Scripps HealthExpress is all over the county, from north to south. And then when are they open? When are they open? Because when you get sick or you need medical attention, it isn't during normal business hours.
That's right.
Correct. And so this is the really exciting thing. Our express clinics, they're open 7 days a week, Monday through Friday, 7 a.m. to 9 p.m., and Saturday and Sunday, 8 to 5 p.m., 8 a.m. to 5 p.m. So if your doctor is not available or you can't go during work hours, you can just pick up the phone, call us. You can actually do a walk-in. It's very easy.
There's no appointment necessary, right?
Correct. No
you don't
appointment.
need to. But you can also call Scripps HealthExpress to make an appointment if you want.
Well, we don't call them appointments. We reserve a place in line because, again, this is a walk-in clinic, but if you want us to hold a place in line for you, you can actually go on our website and do it electronically or call us and we will actually put your name down on the list.
And you don't necessarily need to be a Scripps patient, right, to have Scripps insurance to go to Scripps HealthExpress?
Absolutely not. We accept all patients with all different insurances and also on a cash basis. So anybody in San Diego can use our services.
And then you also have pediatric clinics at 2 of the sites?
Yes, this is very exciting for us. We have pediatric specific providers at 2 of our locations. Currently that's Rancho Bernardo and Carmel Valley.
And that's kids what age?
We see kids 3 months through 17 years of age.
And they can, the hours there are?
So currently the Pediatric HealthExpress clinics are available 5 p.m. through 9 p.m. Monday through Friday and 8 a.m. to 5 p.m. Saturday and Sunday.
And the Scripps HealthExpress, this walk-in clinic, this does not replace your primary care physician, correct?
No, and they weren't meant to do so. This is really to supplement our offerings for our patients and for our all of San Diego. So primary care, we recommend that you see a primary care doctor for your health physicals, for chronic disease, for anything that requires more than one visit. So really, although your primary care doctor can see you for your cough and your cold and the bladder infections that I mentioned, sometimes they're closed when you actually need to see them, or sometimes they may not have an opening until 2 days from now. So this is an additional resource that we are offering to our patients.
And if you're in doubt about where to go, what should you do between walk-in clinic, urgent care, ER?
So we have a nurse phone line that you can actually call for HealthExpress. If you're not sure, you can always call, and our nurse will actually ask you questions, and based on your symptoms and your medical history, give you advice on where to go. If you're not sure and it's something you think is serious, I recommend you call 911. Better safe than sorry. But if you go to any of our clinics, if you go to HealthExpress clinic and they evaluate you, if you need to be sent to an emergency room or sent to an urgent care, they will let you know at that clinic at that time. Mm-hmm.
Dr. Evans, what about you? If somebody's unsure where to go, whether it's the urgent care or the ER, what should they do?
I always tell them if they really feel that this is the last day that they're going to have, or they have questions about an illness that they know is serious, or they've felt a rapid change in their condition, that's the emergency department. After that, most folks will do perfectly well calling the nurse hotline, calling their primary care physician, and we're always available to take questions. And the nice part I love in the Scripps Health system is that regardless of the venue that you choose, your primary care doctor is going to have that information the first thing that they arrive in the next morning.
All right, so we referenced this a couple of minutes ago. Let's come back to this. Why are people reluctant to call 911? You hear all these stories about folks, feeling short of breath, chest pain, and then they get in the car and they drive themselves to the ER.
Very hard to acknowledge that you need help for all of us. Nobody wants lights and sirens and firemen and folks in big heavy yellow gear walking up to the house and knocking on the door and to be surrendered to help. When they arrive in the emergency department, that's probably one of the most sensitive things that we see, is that folks come in and this is the first time in their life they've really needed help, that they felt imperiled. So 911 is an absolutely wonderful and fundamental element of our society and of our critical resus team. When to call is important, and I would say that if somebody feels they're going to lose consciousness, if they can't mobilize themselves, if they don't have access to transportation, if they have any of the big three, if their head, their vision, their breathing or their chest, for example, or their abdomen feels imperiled or severely injured, they need to get to the emergency department, and it's 911 every time. Strokes and chest pain are the two most popular source of complaints where people will take 911 appropriately. So if somebody's dizzy or has slurred speech or trouble with their vision or difficulty mobilizing themselves or chest pain of any sort, that really is 911, so that those access providers can get you there in traffic, out of traffic, and you're with somebody who can responsibly take care of you, more important, when you're on your way.
I would add to that, I think that sometimes patients are scared that maybe what they have is not a true emergency and they don't want to waste people's time. I also think that sometimes people think, is this going to be covered by my insurance? Is this going to take a long time? There are many reasons that I think people are reluctant to call 911, but it is scary. Am I sick enough to warrant a whole team of emergency personnel to come to my aid?
Yeah,
So,
I would really platform on that. That's one of the first things that people will say is, was this appropriate? They don't know, but I can tell you it's appropriate. And if they were that concerned, they're protected, they're understood, and they're going to be received in a warm environment where we know that you had no other opportunity but to call 911.
correct. I agree. Better safe than sorry.
Absolutely.
So err on the side of caution.
Please.
Correct.
Okay. How should you be prepared when you go to any one of these places? What should you bring with you if you're going to go to urgent care Well, or the ER or the walk-in
I
clinic.
think know that the person taking care of you, whether it's the nurse or the doctor or anybody else, they want to know your medical history. In order to treat you appropriately and to give you the best care possible, they need to know what allergies you have, what medications are you currently taking, what medical problems have you had, do you currently have you had any prior surgeries? All of these actually make a difference when a provider who's assessing you wants to quickly and accurately diagnose you and treat your condition, whatever that is.
I would agree. And as accurate as our healthcare record is, there's always a little disparity because of recent events where somebody might be on a different medication or they're traveling. Please keep a list of your medications, include your allergies. And there's one more thing. Provide a phone number of somebody we can reach out to who can give reasonable information in the event that you become unconscious. Or alternatively, somebody who knows you and can help you to make decisions if things are dire.
Okay. What about letting somebody know if you're allergic to anesthesia?
Always important. Always important. That allergy profile and the significance of that allergy. Many times we'll see lengthy allergy profiles, but none of them are significant. And what we want to know is anything that we're going to give you in a life-threatening crisis going to contribute to harm? That's what we need to know.
Okay.
Right.
And you say bring a list of medications. Would that include supplements as well, or just prescription drugs?
Absolutely. Supplements can also cause interactions with other medications, and also some people are sensitive or intolerant of ingredients in the supplements that might be in the medications we prescribe.
Again, I would just emphasize for a moment that anyone traveling, if they've had any health issues, if they've had to previously use 911, if they take medications, it really is reasonable to sit down and list their medical issues, their surgeries, whom we can call, their medications, and their allergies. Those 5 things alone give us an enormous leg up in the event that somebody from out of town, we can't access their information in a timely manner. It really does help, and it also lends to the accuracy of us taking care of you.
And time is really critical when things are
Absolutely. It's a
in
big
an
deal.
emergency situation.
And even in a non-emergency situation, the more information you can give us up front, the faster we can see you and have you on your way.
All right. So the bottom line, trust your gut.
Unless your
Yes.
gut is sore.
Any final thoughts?
Yeah, I would say that people's respect for the 911 system is appreciated, but that if you feel you need to use it, please do so. That system is in place to get you to the hospital at a time when you're in crisis or you're not sure what to do with your family member. The one thing we do see is with both strokes and heart attacks, people will oftentimes go to bed with their symptoms. We've all gotten better going to sleep and feeling better the next day. If you're someone who's at home and it's the evening hours and you're not feeling quite right, it's probably not best to go to bed. It's probably best to at least get some nurse advice over the phone, or at least engage a family member and consider getting to the hospital that night as opposed to waking up with much more significant symptoms.
So, and I would like to add that for our HealthExpress clinics, it's a wonderful resource because we mentioned earlier, if you're very sick and you go to the ER urgent care, you're seen first, which means if you have a cough or you're a bladder infection or a rash or anything else that's considered less serious, you will be put at the back of the line. You will have to wait a little longer while we deal with these life-threatening conditions. So the HealthExpress clinics are wonderful in that because you walk in, you will be seen much more quickly. You won't have to wait sometimes hours, depending on how busy and which place you're going to. And some of these conditions, because you're seen more quickly, we have patients who, because they don't want to go to urgent care and wait or go to the ER and wait, this is actually a place where you can get care and not delay treatment for issues that shouldn't be delayed.
All right, that strep throat.
Correct.
That nasty throat or that nasty earache.
Or the bladder infection that can, if untreated, turn into a kidney infection.
My family and neighbors love the HealthExpress system. And the physicians and staff are fantastic, and their ability to refer and their ability to get you where you need to be should something need to get escalated is absolutely wonderful.
Thank you both very much. Scripps is repeatedly ranked by U.S. News & World Report as among the top healthcare systems in the nation. If you'd like more information on where to go, urgent care versus the ER, or Scripps HealthExpress, the walk-in clinic, and when to call 911, please just click on the link or go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.